How many grafts do I need? Hi, I am Dr. Arvind Poswal from Dr. A's Clinic, Delhi, India. And today we will be talking about a topic that is very, very important to anyone going for a transplant. Now, for my particular case or my clinic, I normally do 7,000 to 15,000 graft procedures, even going up to 20,000 grafts procedure in patients who have that many grafts. Often people ask me, patients only, who go to multiple centers, they will be contacting 10 different doctors or clinics, asking them, how many grafts will I require, how much will it cost? And then when they come back to me, they are asking, why are other doctors saying that we will transplant 4,000 grafts for you, or 3,000 grafts, or maybe even 5,000 grafts for you, where you are telling me that you will transplant that I need 7,000 or 10,000 or even more grafts. So today I will help you solve this mystery. See, hair transplant has progressed tremendously as a science, especially in the last 5 to 10 years, especially in the last 5 years. Now when we are talking about hair transplant, there are almost as if there are two different levels of technology. One is the technology where I can use grafts from your head, from your beard, from your chest, from your armpits, from your pubic area. And I can use all of these here to fill up your head as densely as possible. Now there is, by contrast, an old method, an antiquated method which I'll talk about. Around 10 to even 20 years ago, doctors, they used to see a very bald patient and they will think in their mind, okay, how many grafts can I do for him? And they may be able to do 3,000 maybe, or a maximum of 3,500 to 4,000 grafts. So they'll tell the patient that this is what you require. Now, a person who is totally bald from here to this area, and you tell him that he needs only 3 to 4,000 grafts, and after that you tell him, please manage your expectations and be reasonable in your expectations. That I think is wrong on part of doctors. See, it is very simple. Now when it is known that yes, we can use donor hair from the beard and even from the chest, if the chest hair is really long, something like 2-3 inches long and grows fast, we can use even that. And I have published these cases, these results around 10-15 years back. This technology is not something new. So we can use thousands and thousands of grafts. In an average patient, I can get 4,000 grafts from the beard and another 3,000 to 4,000 grafts from the head. That will make 8,000 grafts, and we can fill this area at a good density. We will not be saying that, okay, fill only this much, this 2 finger width with good density and don't go for low density. See, that is not going to look natural. One whiff of wind and then you will be covering those hair. What a person who has lost hair, when he is going for a transplant, then he is thinking in his mind that, okay, I'll have a good amount of hair in most, if not all, parts of the bald area. So the problem in terms of what the doctor should be saying is, they should be telling you that, see, your head contains 40,000 grafts. If you are 50% bald, that means you have lost 20,000 grafts. If I look at your head and your beard and maybe your body, and I see that I can, yes, do 8,000 grafts for you, and that has been possible by the fuse or the FUE technique. It is a stitchless method in which we can take out all grafts. We have taken out grafts from the eyebrow, we have placed them here in a Miss Earth contest, nothing less, without any visible scarring. There may be microscopic level of scarring. So we can do that, and we have shown it on innumerable cases. You go to our result gallery, you go to our repair result gallery. So you will find cases. So it is important on your part as a patient also to not just try to hear something that you want to hear from a doctor. I know many a times the patient go and they say, okay doctor, how many grafts do I need? Now they are thinking that okay, if this doctor says 4,000 is all I need, then that would be sufficient for me. It's like keeping your eyes closed when all the knowledge is there. If you know that you have lost hair in this entire area, nature gave 15,000 grafts at least. 3,000 graft is not going to cover. 3,000 graft reflects the lack of ability, the lack of experience of the doctor who is not putting grafts. Now when you are going for the procedure, I think it should be a ethical way for a doctor, a correct way for any doctor to tell the patient that yes, we know that yes, beard hair can also be used. And if they cannot use, they should mention it that okay, they cannot take this hair, they are not comfortable or they are not experienced enough. And they should also tell you that 3 or 4 or even 5,000 grafts is just barely enough to cover this part at a good density. Now coming back to patients, when you are going for a transplant, be very open with the doctor and tell him that you want a young hairline. If you want a hairline like this, it is a young hairline. Tell the doctor you want a young hairline. Let him draw out the hairline. Then see till which area do you want to cover. Let's say you want to cover till this area. Then just put a tracing paper on that area. You measure out the area, draw out the area. Then you measure the area on that paper to see how many square centimeters it is. If this is 10 centimeter by 10 centimeter, that itself becomes 100 square centimeter. That would be just this much area. Now 40 grafts at 100 square centimeters becomes 4,000 grafts. So 4,000 graft is going to cover this much area. I am making it like this so that you can see it will not cover this much area. If you try to spread it out over double the area, it will only give you a thin appearance. Everyone will be able to make out that you have got something done. You will not be happy with that. So when you are going for a high quality hair transplant, don't settle for a low quality transplant. I have seen too many low quality transplants with hair growing like this towards the sky, with 3 hair grafts right in front of the hairline, with grafts far apart from each other, and with hardly any density in this place. So what will you call that? Technically you can call that a hair transplant. But from terms of art, if you look at it artistically, is that man happy with this hairline? Is he happy with this hair transplant? Is this what he thought? I remember around 20-25 years ago when I started doing hair transplants, we doctors could take out only head hair graft. And so 3,000 grafts was the limit. If you read the textbooks of that time, it was common to say that okay, 3,000 graft is a big mega session. And patients should always keep their expectations in confinement because they cannot be met with that many grafts. So in today's time, when someone tells you that yes, we can do hair transplant, you should ask them which all hair can you take and how many grafts do you think you can take from me. Once they tell you that they can take out these many grafts, then you ask, can't you do more? Go for the maximum number of grafts because you want maximum density. Going for a hair transplant, you don't want a low density. You are not going to buy a Ferrari or a Mercedes, then just because you want something cheap, you end up with a Maruti 800. That is not what you are planning. This hair is your image. This hair is what someone will see you as, your personality. This is much more valuable than your car, than your earrings or your gold rings or chains. You need not spend on them, but spend on your personality. This particular look of the hairline going all the way back, 10,000 grafts in this area will make it really dense. And I have innumerable cases on my results gallery. You go through them, see the results. One final thing I'll say, educate yourself. See, more and more young doctors will keep on entering this field. And you cannot rely that, okay, they would have learnt enough. And you cannot rely, say, I'll go now and I'll ask this other doctor, maybe he'll say a lesser number of grafts. If he says a lesser number of grafts, you will get lesser number of hair. That is all. You will not, there is no magic. There is no magic by which you can make a Norwood 6 patient, something like who? Amrish Puri? No, not Amrish Puri. Something like Anupam Kher. Right? He has hair only in this part. Now if someone says, okay, in 5,000 grafts I'll fill his head. That is not geometrically, mathematically, logically. It is not possible. So always measure your area. If you don't want to do anything else, at least measure the area of baldness with a measuring scale. And go for the maximum grafts that you can go for. That is what you are going in a hair transplant. One thing is that. The other is also always check the track record of the doctor or the clinic. If they have just 10 or 20 or 50 results to show, and those are all about 2,000 or 3,000 grafts, then they are not experienced for 10,000 graft surgery or even 7,000 graft surgery. I hope I helped you. If you have a bad hair transplant, do not hesitate to contact me. Show me the pictures. I'll tell you how we can best correct it, make it into a wonderful thing for you. Hair transplant was meant to make you happy. It was not meant to make you end up with some irregular sort of hair growth. So remember, we are there on WhatsApp as well as email. And do like, share and subscribe this post. Thank you very much. Bye.